Hi, this is Sarah calling from the Fairfax County Health Department. Is this Kelly?
This is Kelly.
Hi, I'm calling as part of the COVID-19 response. Before we continue, we want to make sure everything's confidential, so I'll need to confirm your identity. Would you be able to tell me your last name, but also the month and year of birth?
Yeah, so my last name is Annette, month, May, date of birth, year of birth, 1990.
Great. And I have that you live on Elm Street. Do you still live there, and can you confirm the house number for me?
Yeah, I still live at 405 Elm.
Great, thanks for confirming that. Is now a good time to talk? This should take about 15 to 20 minutes.
Yeah, that should be fine.
Perfect. So as I previously mentioned, I have some information as a follow-up to your COVID-19 test. Have you heard from your medical provider yet?
Yeah, I talked to them the other day. They said I was positive for COVID-19 and that I should expect to hear from you. I've been taking a lot of care since then, since I really started developing some symptoms. So I'm staying home. Don't want to pass this virus on to anyone else. That would be the worst.
Okay, yeah, it sounds like you're taking a lot of precautions. And I'm glad that you were able to touch base with your medical provider. I'd like to go over a few questions about your symptoms, who you might have been in contact with, and then kind of just walk you through this whole process.
All right, go for it.
Great. So since you have tested positive, the health department guidance for you is to completely isolate from others in order to really stop the spread. What is this? Do you think that that would be possible? What may be some things that make that possible for you?
So when you say isolate, you mean like away from everybody?
I do. It would be away from everyone else. Yes.
I mean, I said earlier I've been staying home, but it's really not possible for me to isolate from everyone because I have 3 roommates and we share all of our common spaces. So I can stay home, but I can't stay away from them.
Hearing that you do share a lot of your common spaces in your home, but are there some spaces in the house that you don't share and they're just yours?
I mean, my bedroom is mine and I do have a bathroom attached to that. Um, I mean, but I live with my roommate, so I've already been around them. They could even have it already.
Well, it's actually still important for you to isolate because even though if they've been exposed to you, they may not have COVID-19. So if you continue to use those common spaces, it really increases the risk of them getting COVID-19.
Hmm. Well, I mean, but I'm not going to stop using the common spaces. I pay for those, and it's expensive.
It sounds like those spaces are really important to you. I also heard you say earlier that it would be, kind of the worst if you pass COVID on to someone else.
Well, yeah, I mean, I feel like crap, and I don't want anybody else to feel this way. But I mean, I just don't think that not using the common spaces is really going to make that much of a difference. I stay clean. I wash my hands like everybody's telling me to. I'm covering my coughs. And I mean, the couch is so much more comfortable.
Yeah, comfort can make a big difference when we're sick, and it sounds like you don't want anyone else to get COVID-19. So at the health department, we really know that one of the best things to do to protect others from getting sick is to isolate. And it sounds like you really care about these other people. So what may be some things that we can look into to help you isolate comfortably while protecting the people who are important to you?
Yeah, I guess I hear what you're saying. I mean, these are the best roommates I've ever had. So, but I just don't know, how am I going to be able to get food if I can't even go into the kitchen and cook?
It's a really good question. And we can actually talk through that challenge and any other challenges that we identify and kind of come up with some solutions together. I may actually also be able to connect you with some resources to help you with that specific need.
All right. I like the sound of that. Let's do that.
All right, great. Before we really get into that, I first want to get a little bit more information about who you've been in contact with so that we can follow up with them and really make sure that they're staying safe and healthy. Is that okay?
Yeah, that would be fine.
Great.